Now we're going to talk about the breast reconstruction, which is also an important part when you're doing the mastectomy. So, because most of the people in the Western world or in developed countries, they ask for the breast reconstruction. So you should know the options we have available. A breast surgeon combining with a plastic surgeon usually performs the surgery. And the reconstruction depends upon the tumor in which radiotherapy is to be given or not. So sometimes in which you are clear about the margins and you don't have to put your patient on a radiotherapy later on, then you can do the reconstruction when you're performing the mastectomy. But in case of the tumors in which the margin is not clear, or you are not sure about the margin and you just have to wait for the histopathology, then obviously the radiotherapy and maybe possible there is a need for radiotherapy, so you have to delay the reconstruction. Okay, so but there is a disadvantage of delaying reconstruction. Obviously the flap would become redundant, and there would be some other complications as well. So as early as reconstruction is possible, the results would be very good. And when you talk about the options for this reconstruction, is you have the tissue expanders. The other option is like you can go for a silicone implants, and which is in the form of a silicone gel, and the plasma expanders or the tissue expanders also use. But there are some flaps which are usually gaining popularity. The mini flap and the myocutaneous flap. So latissimus dorsi muscle, which is making the posterior wall of the axilla, most of the time this flap is used for the reconstruction procedures. And depending, if you don't have to go for a radiotherapy, you can do along with the mastectomy, or you can delay it after the radiotherapy. Because if you are putting the patient on radiotherapy, then obviously flap will be necrosed, and there will be no need for the breast reconstruction. Okay, so you do the LD flap, which is the latissimus dorsi flap. You can take a mini flap, or you can take a myocutaneous flap. And there is another option, which is the trim flap, which is the transverse rectus abdominis muscle flap. It is also a myocutaneous flap. So transverse rectus abdominis muscle flap is gaining popularity day by day, because those people who have a little belly fat, they can also get rid of belly fat when you are doing the trim flap. Then there is another possibility for the reconstruction, which is a DIEP, deep inferior epigastric artery perforator. So this has actually no muscle. So LD flap would have a little bit portion of the muscle. Trim would also include a muscle part, and DIP would be perforator, so there would be no muscle portion. So that's how you can do the breast reconstruction, depending upon the choice of the patient, and depending upon the condition and the tumor, like silicone gel, tissue expanders, LD flap, trim flap, DIEP flap, and sometimes you have to combine it with the proper nipple reconstruction, which is called as a memoplastic techniques, in which not only the breast tissue but also the nipple reconstruction is also being done. Okay, so the typical tram flaps, which is the transverse rectus abdominis muscle flap, they're called as a body lift reconstruction. So you can see actually this was the part where the flap was being taken for the both breasts. So if you do a bilateral mastectomy, so you can take a bilateral flap, or so you can get rid of this belly fat as well. So this is a body lift breast reconstruction. So there are some other, not only in case of breast mastectomy, but some cosmetic surgeries as well, like mammoplasty and reduction mammoplasty and augmentation mammoplasty, in which these tissue expanders, silicone gel, they are also being used. So in this lecture, we talk about the breast cancers, and we more precisely, we talk about the surgical techniques like mastectomy, lumpectomy, chordectomy, perimastectomy, which is the modified radical mastectomy, and how you're going to perform the axillary clearance, and how the reconstruction and what options you have available for the reconstruction we have discussed in today's lecture. So that's all for today's lecture. Thank you for watching sqadia.com. Keep watching sqadia.com.